My first impression was the location, very, very central in Athens, very easy for invited speakers to get here. But I think mainly it's the pre-conference. Everybody was so organised, and then when I got here, very welcoming, so I knew exactly where to come to. Although I had to go and ask them this afternoon, did it start at 5 o'clock or 5:30? Because I wasn't quite sure. And they provided me with, because I'm English, they provided me with a programme in English, so at least I knew what the other talks were about. And I love the trade exhibition as well. And I love meeting my old colleagues. I've known a lot of Greek oculoplastic surgeons now for between 10 and 15 years. We belong to various societies, the European Society of Ophthalmic Plastic and Reconstructive Surgery. They come over to our British Society, the BOPS, or British Oculoplastic Surgery Society, and we exchange ideas. So I think there's so much about the meeting, so different aspects. There's the trade exhibition, there's the networking and meeting people, and then there's the sitting in the lectures and actually listening to the lectures. I've had the headphones on, so I've had dual translation, well, I've had translation, so I've been able to understand. And then many of the slides have been in English, so it's been quite easy to follow.
And would you tell us a few words about your very interesting lecture?
The lecture I gave this afternoon was about watering eyes. Watering eyes doesn't immediately sound terribly exciting, but actually it's a very troublesome problem. People look as though they're crying. And I was talking about whether you should do an operation through a small skin incision on the side of the face, so about here, or whether you should do the operation through the nose, and what does it really matter? So that's what it was about.
And do you think that the research and all around this kind of issue are in the process of making some new highlights and results?
There's been some big leaps and bounds in lacrimal surgery, particularly with endoscopic endonasal, so DCR surgery, so where you can work entirely in the nose, and that means you don't get any scar. And even with that surgery, there's been better equipment, and now we have better experience. However, in all these things, you've got to not dismiss what you had before. And so where we would do a small incision through the skin, if it was a lady or a man who's aged 105, then you're probably going to do it under local anaesthetic through his skin and not do the more technical operation through the nose, which requires a general anaesthetic, which carries risks. So everything is a balance between the modern and what you can achieve, and then what's actually practicable in the situation with the patient there in front of you, what's best for that patient. So the conclusion at the end was, yes, we've got, endoscopic endonasal DCR is wonderful. You get a wonderful view of an area that's only about 5 millimetres, and you're seeing it on a big screen, half a metre high. And so it's very precise. But is that always needed? There will be occasions when it's not.